No one that I know personally or that I've heard of is actually hoarding it to an extent that would cause such a decrease in supply.
Struggling to find liquid painkillers for their children, some parents are worried about the shortage. One Calgary mom whose son recently contracted COVID-19 says he had to suffer 3 days before she could find any painkiller.
I spent 3 days trying to find a supply of any sort of Tylenol or acetaminophen specifically for infants. I even called 811, and then the lady on the early start line did suggest a gas station, and that just happened to be where I found it. But I looked at over a dozen places, including grocery stores and pharmacies.
Like Sarah, Alex also struggled for many days before finding any liquid painkiller for her son, who had just gone through surgery. She says whatever the reason for the shortage, it needs to be dealt with.
I know some people are saying that we should have it as a prescription or something just so we do have extra stock. So not necessarily have all of it as a prescription, but something, we need to do something. If he's having just a day's surgery, I can't imagine the moms that are going through the same situation, only it's a way bigger surgery for them and they're not able to find anything. It's heartbreaking to deal with.
Some pharmacies say people are hoarding stock of infant painkillers due to fear of illness and COVID-19. While some parents have outright rejected this claim, others say those who get the stock need to be mindful of others.
Honestly, if we can limit people to, like we did during the pandemic, people are going crazy over toilet paper, and they finally put a limit on it, and it should be something like that as well for kids. We kind of freak out if we don't have our medication for our kids because you want to make them feel better, and it's like a physical pain that you get when your kids aren't feeling good.
In Calgary, Henna Saeed, City News.